My name is Erica Sunan, and I'm a speech language pathologist at Little Steps. I wanted to talk to you today about why we use signs in speech therapy. The first reason I introduce signs is to reduce frustration by giving the child an alternative way to communicate rather than just pointing or whining or tantruming. Second, it's easier to imitate a gesture than imitate a sound or a word. The first step to imitating words is imitating gestures like waving or nodding. So if a child is unable to imitate words and sounds, they may be able to imitate or use a gesture. We can also support this through giving the child hand-over-hand assist, or taking a child's hands and showing them this sign or gesture. We can then reinforce this behavior by giving the child whatever they have asked for, even if it is with our help. Finally, it can show the child the power of communication. They can learn that an abstract symbol or sign can represent something concrete. Research has shown that signs, pictures, and other forms of alternative augmentative communication only encourages language development. When we teach signs to children, we always verbally label them so they receive that language reinforcement as well. Eventually, if able, a child will find that it's easier to use a word to gain someone's attention and request rather than put down whatever they're playing with and use the sign. Thanks for listening.